is Eric Janis. I'm a Deputy County Administrator for the Franklin County Board of Commissioners and the Vice Chair of the CelebrateOne Board of Directors, and I welcome you this morning. And I am here on behalf of my chair, Karen Morrison, who couldn't be with us this morning. We're here today to share information about our 5-year strategic plan and to underscore our focus on reducing infant mortality here in Central Ohio. I want to start with some important introductions, if I may. First, let me recognize those CelebrateOne Board of Director members who are here with us today, and I would ask that they please stand. I see Dr. Mysheika Roberts, Reverend Caesar, Tim Robinson, and I may have missed somebody. But welcome all, and thank you for being here this morning. We do not do this work alone at CelebrateOne. Today we're joined by several of our lead entity partners who help us accomplish the work of the infant mortality reduction in Columbus and Franklin County. And I'd like to recognize some of them here. We're joined by the Central Ohio Hospital Council, Ohio Better Birth Outcomes Collaborative Moms to Be, Franklin County Family and Children First Council, Franklin County Department of Job and Family Services, and we're pleased to have several members of the Ohio Better Birth Outcomes Collaborative joining us as well. These are representatives of the birthing hospitals and federally qualified health centers that we align with very closely, and will continue to build stronger ties with them to do the work of health equity that you'll hear about shortly. We also have with us today representatives of Heart of Ohio Family Health Centers, OSU Wexner Medical Center, and Nationwide Children's Hospital and Mount Carmel. It is our work to save babies and support families from pre-birth and beyond, and it is more critical today than ever before. This pandemic revealed so many gaps in our healthcare system, our social service safety net, and so much more. We've learned a lot, and we've stepped up as a community. And for CelebrateOne, we are taking what we've learned over the course of our journey and looking forward. Since 2014, when Mayor Ginther created CelebrateOne, we've been deliberate in establishing programming and building partnerships that change lives. We've made progress, and yet we are still not where we need to be. So our work continues, and we have this 5-year strategy with a keen focus on addressing health disparities as it relates to infant mortality. Today, you'll hear more about CelebrateOne, our plan, where we are, and where we're headed. And now I'd like to turn it over to Mayor Ginther. Mayor.
Good morning, and thank you very much, Eric, for not just the county's significant financial partnership with all of our work for CelebrateOne, but for your personal investment, your leadership, guidance, and vision on the board. I do want to thank the commissioners by name, though. Commissioners, formerly Commissioner Marilyn Brown, but Commissioners O'Grady, Boyce, and Crawley for their significant investment and partnership. We wouldn't be where we are today without their support. And former Governor Kasich and current Governor DeWine with the fantastic support and partnership from the state of Ohio. We're grateful for that. It is great to be here today and be part of this important moment for CelebrateOne and our entire community. So many individuals and families have endured devastating setbacks, as Eric mentioned, during this pandemic, and along with our nation's gradual and uneven road to recovery. So as we look to the future, we look at our next steps forward, we must do more than simply rebuild what we've lost. We must also build back stronger and more resilient than we have ever been before. Chief among our priorities is investing in the next generation today, and CelebrateOne is doing just that and making an impact. Thanks to Director Stapleton and her team at CelebrateOne, our dedicated staff at Columbus Public Health, and our incredible partners who are represented here today, all throughout the community. Think about this for just a second. We as a community have reduced infant mortality in Franklin County by 28% as a community. That's something we can be proud of. I see Dr. Pat Gabby, who's one of the co-instigators with this movement, and think back to the time that we met in Wyland Park to visit that church about the moms-to-be, and how we've really grown this effort into a movement, something that we can be very proud of. The infant mortality rate in our CelebrateOne zip codes, which are our city's opportunity neighborhoods, has dropped by 20%. Sleep-related deaths, one of the leading causes of infant mortality, has decreased greatly through education, training, and the distribution of cribs. And even though we've made great success in reducing infant mortality overall, the racial disparities continue to persist. When compared with white babies and when looking at our CelebrateOne zip codes, Black babies are more than 2 times more likely to die before their first birthday. Unacceptable in this community. Countywide, Black babies are more than 3 times more likely to die before this critical milestone. This is an unacceptable trend, and we're committed to reversing it, building on the momentum that we have built as a community, because we're committed to reversing it. To start, we're expanding our efforts to improve the health of women before they become pregnant, as well as decreasing the number of premature births. And we're analyzing these issues from multiple angles, including housing and programming, resources and intervention, and new opportunities for support during pregnancy, after pregnancy, and beyond, really delving at the social determinants of health through an equity lens, laser-focused on race. Our mission is as vivid as it is urgent, and that's to ensure babies reach their first birthday and continue to thrive in their early years, those formative experiences that follow. Our children deserve all that we can bring to bear to support them in their earliest years in this community. Director Stapleton has been working diligently to tap into leading-edge research and expertise here in Columbus and across the nation to dive even deeper into the racial disparities influencing and underlying infant mortality. She's undeterred in confronting these disparities in direct and targeted ways and stabilizing families through meaningful action. We'll hear from her in just a few moments, but first, we know this work wouldn't be possible without our frontline medical and research professionals, folks in our health systems who have been our partners from the very beginning, and we appreciate the work of the council and all of our health systems being part of this effort. Columbus Public Health is leading the charge in addressing racism as a public health crisis, and their focus on social determinants of health is so critical to what CelebrateOne is doing on behalf of our neighbors every single day. Here to tell you more about this important work of public health is our city's health commissioner, Dr. Mysheika Roberts. Dr. Roberts?
Get out of the mask. Thank you so much, Mayor Ginther, and thanks to all of you for joining us today. Columbus Public Health is proud to join you as well as CelebrateOne as we work together to help reduce infant mortality and save our babies and make sure not only do they live, but they thrive. Infant mortality is a complex problem, and it's a problem that CelebrateOne cannot do alone. None of us can do alone, and that's why we're all banding together to work on this important issue. We have to be part of the solution. Together, we must focus on policies and practices that impact the health of not only our mothers, but also the babies and the entire family. As we look to close the disparity gap, and we know that this pandemic has exposed some of the disparities, not only in our community, but really across the nation, The health of our Black and brown mothers and families are our top priority. As the mayor said, racism is a public health crisis, and it's something that Columbus Public Health has been working on for some time. We also know it has a direct impact on infant mortality and the overall health of our community in every segment of our community. Housing, transportation, education, jobs, and healthy foods. Those are all the social determinants of health, and they all play a critical role on infant mortality. Columbus Public Health's partnership with CelebrateOne has been long-standing and will continue to grow. Our collective work to reduce infant mortality includes supporting housing, conducting home visits, and I would say that it's just not home visits. We will meet moms wherever they want us to meet them, at the local McDonald's, at the library, even at a rec center. Whatever is a comfortable environment for the mom to meet one of our home visitors, we will meet them where they are. This is ensuring the health of mothers and babies, providing good nutrition, breastfeeding support, providing cribs, car seats, safe sleep education, all to reduce preventable infant deaths. We will continue to work with CelebrateOne as well as all of our community partners to ensure healthy babies and families right here in our community. And now I would like to turn the program over to Maureen Stapleton, the Executive Director of CelebrateOne, who will share more details about our strategic plan. Director Stapleton?
Well, thank you, Dr. Roberts, and to the mayor and the board and each of you for being here and being focused on maternal health, prenatal care, safe sleep, safe housing for families, and ultimately reducing infant mortality in our great city. Before I begin, I'd like to just introduce and have stand, again, we don't do this alone, but there is a team at C1. Would the C1, CelebrateOne team members please stand, please? Thank you. This truly is a wonderful day, and we are excited to share our vision for addressing infant mortality as we look ahead for the next 5 years. As a backdrop, I would like to level set with some data so that you can understand where we were and how we compare against our counterparts. As it relates to infant mortality in comparison to the entire state and what we call the big C's, Cleveland and Cincinnati, this chart shows that infant mortality in Franklin County between 2012 and 2020 continued to decline. Franklin County deaths per 1,000 births are tracking with the state average, and we are doing better than our counterparts in Cuyahoga and Hamilton. Prematurity, or what we would like to call extreme prematurity, which is 32 weeks gestational age or less, is in this slide. This slide shows the percentage of birth less than 32 weeks, and again, extreme prematurity. Prematurity is a #1 indicator and leader in infant mortality, and so it is something that we absolutely have to keep our eyes on. There's an additional layer of information in this slide. Non-Hispanic Black infant mortality in the solid lines at the top versus non-Hispanic white infant mortality with the dotted lines at the bottom from 2012 to 2020. And again, our percentages of extreme prematurity for Black babies in Franklin County is better than our other counterparts across the state. And while white infant mortality at the end of 2020 was pretty much equal amongst all of our comparable counties, the extra layer of information on this slide is the difference between the dotted lines and the solid lines. Non-Hispanic Black babies are not faring as well in this state as non-Hispanic white babies. So we use the next slide to show the differences in a way that really, I think, drives it home. When we use this slide, we focus on health equity, and specifically the need to prioritize racial equity and accelerate the progress that we are making in our community. While white infant mortality in Franklin County decreased from 2014 to 2020 by 28%, and Black infant mortality declined 23% in that same time period, I want you to take note of the blue bars and the green bars. The blue bars represent white infant mortality, and the green bars represent Black infant mortality. And as the mayor indicated, that means that there's a 2.8% difference. 2.8 difference between Black babies and white babies. Now, what's interesting also about this slide is that on the yellow line shows the Healthy People 2020 goals. We have not only met the 2020 goals for white infant mortality, we've exceeded the 2030 goals. Yet, there is still the lag with Black infant mortality in Columbus. So, get to my next page here. We like to use this next slide, compliments of HRSA, because they did it better than we could have probably imagined. What you're seeing here is that it took 37 years, from 1980 to 2017, to have Black infant mortality rates meet the same level as white infant mortality rates. 37 years. If Black infant mortality continues at the same rate over the next period of years, the next time we will see parity or the numbers equal will be 2069. That's simply unacceptable. And so we know it is unacceptable, but we also know that it is not insurmountable. What this means really is that as a community, as a county, we must save 49 to 95 African American babies in order to bridge that gap sooner. What that really means is 4 to 7 babies a month. This is doable. It is not insurmountable. And because of the levels of partnerships that we have in this community, we truly believe that we can be the first community in the nation to tackle the disparities and win. So, the City of Columbus and Franklin County have declared racism as a public health crisis. There is a growing body of evidence that race and racism as an interpersonal, historical, and structural construct is a primary contributor to racial disparities in health. Race and racism play a role in a variety of ways, and it is through these lenses that we must focus our future work. We must look at the institutional pathways where policies, procedures, and practices reduce or inhibit access to conditions of life that support health. We must consider and use the lens of psychological embodiments, where the experience of race and racism correlates with psychological markers that bring on stress and related diseases. We must look and understand that the deprivation of life that's happening in some of our African American communities at a higher level has an impact, and we must address those. We must look through the healthcare inequities where implicit bias and beliefs that one group is lower or a perceived social hierarchy results in disparate care. We know that exists, and our hospital systems are locking arms with us every day to come up with strategies to address it. We must look through the historical trauma and understand what that is, the cumulative emotional and psychological wounding over a lifespan that can impact birth outcomes. And finally, we all must lean into the cultural pathways that we know and use the lens of cultural pathways to expand our understanding and our work where Black people receive unequal health care, treatment, and have unequal outcomes. And so, How did we come up with this plan? Again, not alone. 60 strategic planning members from across our healthcare, philanthropic, and business community came together. Over 5 facilitated sessions with a variety of post-surveys that happened after those with those same folks. We also had 7 community listening sessions with women with lived experience, because you cannot plan around a community. You have to plan with a community. And so we were excited to have those sessions and have people with lived experience through the process. From those meetings, the CelebrateOne, what I like to call 2.0, health equity framework was born. And instead of 8 strategies, we have 6. But I want you to take note of the chart on the right. Programs and interventions must address the life course of a human being, from preconception to pregnancy, to birth, to early childhood, to early adolescence and adulthood. Strategic Planning Committee came up with recommendations based on that life course, strategies, explicit activities that we will undertake, all to drive the disparity between non-Hispanic Black and non-Hispanic white babies down. Ultimately, we know if we address those disparities, we certainly will ultimately lower infant mortality in Columbus and Franklin County. All of those activities and recommendations will allow us to have a level of influence at the society, community, interpersonal, and individual level. The core values of this work for the next 5 years are not much different than what I call the secret sauce of CelebrateOne. CelebrateOne is a backbone agency. We do not do this alone. We work with a ton of lead entities that are leaned in every day to solve this problem, and so we will continue to take collective action. But we must accelerate racial equity and focus on it with our work. We must target upstream. Preconception, what can we do in order to change the trajectory of birth outcomes for Franklin County? We have to catalyze innovation, and that means working with our philanthropic and funding community to understand that sometimes we have to take a chance and work on a promising practice and fund a promising practice versus something we know is tried and true. We have to be bold and innovative, and we will catalyze innovation in this next 5 years. And then finally, again, a secret sauce of CelebrateOne and our lead entities is to advance accountability. We look at numbers on a regular basis. We will increase the cadence of that review of numbers. And we will develop activities and strategies and support the activities and strategies that came out of the plan in order to make that data review more robust. So now, let me take you quickly through the 6 recommendations. Recommendation 1 is to target and address structural and interpersonal racism as fundamental drivers in infant mortality. That includes advocating at the state and local and organizational levels to ensure that Black women's reproductive health and rights are on the radar of all of our partners and all of our organizations. It includes developing standards and assessments and innovative and incentive structures for private and public sector partners to engage in action on racial equity and maternal and infant health. And finally, it includes centering the woman's experience, the Black woman's voice in the experience of her health care. Recommendation 2 is the continuation of what we have been doing since the beginning of CelebrateOne, addressing the social determinants of health across the lifespan, across the life course, to advance maternal child health. This is a continuation, again, of the work that we have been doing. That's increasing accessibility to medical and non-medical transport, ensuring nutritional needs of our moms are met, and addressing the need for adequate, safe, and environmentally appropriate housing for our moms. Recommendation 3 is to advance policies that prevent poor birth outcomes and promote women's health and well-being rights. This includes advancing policies designed to reduce infant mortality and eliminate the racial disparities, aggressively pursuing public and private funding to prioritize maternal and child health, and expand access to preconception care and family planning care earlier on in the life cycle. Recommendation 4, improve provision of reproductive health care from preconception through 1 year of age. Very simply put, the strategies for this recommendation are to continue to improve the quality and the access to reproductive health care, optimizing access points, improving access to sexual health information and education that we continue to do every year with Columbus City Schools, and prioritizing quality improvement at sites of care serving Black women on a regular and consistent basis. Recommendation 5, design and implement a connected and consistent care experience for moms and babies. Connecting families with perinatal support and advocates that can be with them through the process is a linchpin, we believe, to this effort. Expanding and developing additional gaps that we see in the health plan of a mom through centering programs, through doula programs, through the expansion of Moms to Be and other such programs that we know have been immeasurably successful in helping us reach the reductions that we've seen. And then finally, recommendation number 6, accelerate, 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 innovate, and hold our partners and our community accountable for the results that we are seeing. Targeting new investment is absolutely critical. It's something that we've worked on since I've been here, going out for grants and things that we might not have normally done, but we know that it's going to take additional resources and outside resources and new money in order to address this in the real way that we know we can. Continue to implement maternal health solutions and maternal health data review on, again, a more consistent and regular basis, and align our work with our other city and county agencies to ensure that we are getting the biggest bang for the buck for our dollars and our programs. So, what is it that we are asking of the community today? We are asking our community to take another ride with us and lean in. Lean in like never before. And leaning in isn't difficult. It's not hard. It's small things that make a big difference. Place CelebrateOne literature in your lobby if you have a place where people gather. Host a safe sleep training for your staff or the people that you serve. Participate in a CelebrateOne monthly coalition meetings. We have coalition meetings across the community that you can engage in and hear updated information that you can take back to your constituents. Keep CelebrateOne in your mind, and we will, all of our partners here today, keep you in mind as we go after new money and new opportunities to advance the cause of reducing infant mortality in our community. Help mothers, fathers, and families by supporting any program that you hear that CelebrateOne is undertaking. Friend us on our Facebook. Watch us and what we're doing. And if there's a way for you to connect, give us a call. We'll be happy to talk to you. And finally, reach out to CelebrateOne when you are planning efforts specifically as it relates to health disparities and moms and families. It's important. If a society is judged by how it takes care of its most vulnerable, then this is a time for us to lean in. And I truly do believe that we can be the first community in America, because of the collaborative spirit, the Columbus way, to tackle disparities in infant mortality once and for all. So I want to thank you very much. I hope you see that our 5-year strategic plan will require all of us to do a deeper dive as a community, connecting neighborhoods, collaborating on policies, changing policies, that's sometimes often difficult, aligning our efforts and strengthening our existing partnerships so that we can, and also building new ones. It matters because this work is about people, and people's lives matter. I want to now introduce you to a parent, one we call a part of our CelebrateOne family, who will share with you a little bit of information about her journey. Ms. Perry?
Good morning. My name is Patricia Perry. I am the mother of 3 amazing children. I am originally from Rochester, New York. I moved to Ohio a few years ago with just me, myself, and my 2 oldest children. When I moved to Ohio, my intentions were to maintain employment and a career to further my future. For the first 6 years, I did just that. But what I did not do was prepare myself to face life challenges alone and pregnant. In the winter of 2019, I was faced with a very difficult life challenge. I was facing eviction. In the middle of the winter, with 2 children and 1 on the way, no support team, working PRN at a nursing home, trying to make ends meet. At that particular moment of my life, I felt like I wanted to just give up. My soul was down in despair with not a bit of faith in my situation improving. I contacted 211 that provided me with information of organizations that provided housing assistance. My family and I were served with a 72-hour notice to vacate the premises. On the last day of my 72-hour notice, a woman knocked on my door. She introduced herself and said she was a representative of Physician Care Connection, who happens to partner with CelebrateOne, and she was there to pay my rent for me and my children to stay in the apartment. I weep with joy, overwhelmed with happiness, but more saddened to know that others cared. The next day, I received a call from a representative from CelebrateOne. The representative started to share the opportunities that CelebrateOne was offering, not only for myself, but for my children. CelebrateOne provided me the tools to help make me a self-sufficient individual. CelebrateOne provided me with education materials such as a safe sleep plan for my newborn child, assistance with housing, utility payments, career opportunities, moral support, baby furniture, and most important, leadership opportunity. CelebrateOne has taught me to take a life situation and make it the best out of it. With the assistance of CelebrateOne, I am currently a full-time employee with Lincoln Memorial Hospital. I obtained my high school diploma through Urban Lead 22+ program, who happens to partnership with CelebrateOne as well. I also have my phlebotomy license, and I opened up my own cleaning business. But most important, CelebrateOne provided me with the opportunity to serve on CelebrateOne Leadership Council, giving me the opportunity to help make a difference in another person's life. And I am so very happy for the opportunity and grateful awesome. CelebrateOne made me and my family feel more like a family, not just a file number or a case number. We were part of an actual family. With that being said, to CelebrateOne and all the organizations that partner with them, I would like to say thank you. Before my relationship with CelebrateOne, my days were harsh and I could never see the light. It was hard to see myself to have a different sight. And that is where you helped. You changed my point of view. There isn't enough thank you in the world that I can give each and every one of you. But I would like to say thank you so very much. I am so appreciative for all of your dedication and your hard work. Thank you. We're now going to turn it over to you.
Thank you very much, Patricia, for sharing your story and for helping others with their stories. We appreciate the work you do with CelebrateOne. If we can, let's give her one more round of applause, please. Well, you can learn more about stories like Patricia's, other champions, and the work that CelebrateOne does through CelebrateOne's brand new podcast, Maternity-TEA. I downloaded it this morning from Apple Podcasts, and we encourage you to listen to it. Also, wanted to let everybody know that we will be at the Columbus Metropolitan Club on August 25th, sharing the information that we presented this morning with the community and having a panel discussion about this really important work. Finally, I want to thank you to the team and the partners of CelebrateOne, all of the mothers, the fathers, and the families who work every day to reduce infant mortality in our community. We thank you for the work you do, because together we can reduce infant mortality and we can close this racial equity gap. Learn more about CelebrateOne on our website and on our social media platforms. We'll continue to provide information there. And for members of the media, we're happy to take questions immediately following, so I'll ask my colleagues on stage to remain here. Thank you to everyone today for joining us on this important work, and thank you all for your commitment to reducing infant mortality here in Central Ohio. Have a good afternoon. Thank you.